In spring of 2008, I was diagnosed with stage 2 breast cancer. It was a very shocking experience for me because I considered myself to be healthy, and I took all of the steps to always be on top of my health. I had yearly mammograms, and actually it was not the mammogram that helped me diagnose my breast cancer. I found a very substantial size lump, and it came up on a time when my husband was also diagnosed with a brain tumor. So 2 weeks after he was diagnosed with a brain tumor, I was diagnosed with breast cancer. So we had to kind of battle back and forth, surgeries and taking care of each other. It was not unlikely that I was going to get breast cancer, because breast cancer came into my family quite a bit. My sister was diagnosed at 38 with breast cancer, and 4 of my maternal aunts had breast cancer. So it was always something in the back of my mind that could happen, but I always felt that I was taking enough precautionary steps that it was never going to happen. But it was stage 2. I had decided early on to have a bilateral mastectomy. I did not want to ever have the question of cancer coming back in the other breast. So that part was very easy for me, so to speak. The difficult part was finding the doctor. I set out right away in looking for a surgeon, and I knew that I didn't want implants because I didn't want anything artificial put inside of me after having breast cancer, but I really didn't know what my options were. So I spent a lot of time doing a lot of research on this topic and found that there was a procedure called the DIEP flap available, but there were very few physicians that did this procedure. It is a very labor-intensive procedure. It's usually 10 to 12-hour surgery. So you really want to find someone that has done this a lot. Someone who is dedicated to their field, their service to breast cancer patients, and someone that can do this surgery in their sleep. Most surgeons are reconstructive surgeons, are cosmetic surgeons as well, and they do reconstructive surgery for breast cancer patients in addition to their other practice. I was really looking for someone who just did reconstructive surgery for breast cancer patients, and I was very lucky to find Dr. Spiegel. Dr. Spiegel has dedicated her life to reconstructing breast cancer patients and working with them not only on the physical aspects of their life, but the emotional. From the minute you walk into her office, you find a very supportive group of people. Everyone takes care of you and makes you really feel like it's family. I don't live in the Houston area, so it was not a convenient surgery for me to have, and I really tried to talk myself into having implants just because everybody was saying to me, you really want to stay close to home, in a hospital close to home, and have your doctors close to home. But each time I would go to another surgeon's office in my hometown, I was convinced more and more that I did not belong there, that I wanted a large medical center. I wanted a physician that was very, very committed to her practice and an expert in this surgery. And I believe that Dr. Spiegel could really do this surgery in her sleep. She's remarkable. It's a long surgery. I think my surgery was 10 hours, 10 and a half hours. I did have a bilateral, so it did take a little bit longer than most of the other surgeries. But it was something that if I had the choice, I would do it again. I feel wonderful. It was not that long of a recovery. She was fantastic. She was absolutely fantastic. And I feel now that my body is still my body. I have my own stomach tissue that's used for my breast. They're not hard or cold. They are natural, very natural looking. In fact, my oncologist calls me the best the best breast job she's ever seen in her life. So it's been a long journey, but it's one that I'm very happy I made, and I'm very happy I made it with Dr. Spiegel. She was wonderful.